Okay, today we're going to be doing EJV cannulation. My patient here is unconscious. Normally I would gain consent from them before I did the procedure, but because he's unconscious, we're going to go ahead and do it anyway, as this is in the best interest of the patient. Okay, so I'm going to position my patient's head on an angle so I can see his EJV. I'm going to clean and maintain the area. Working in circular outward motion. I'm going to let that dry. I'm also going to look at distending the patient's vein so I can bring it up, so I can cannulate it. In order to do this, if he was conscious, I'd ask him to bear down, but because he's not, I can either press on his liver, or I could lift his legs. I'm also going to press just above his clavicle to distend his vein, and I can see that there coming up. So what I'm going to do is I'm going to get a 14 gauge cannula, and I am going to attach some sodium chloride as a flush. So I'm just going to ask my offsider, first of all I will do a drug check, 0.9% sodium chloride 10 ml, 0.9% sodium chloride 10 ml, and 9th 2020 and 11th 2020. Offsider, if you could please drug check for me.
Yep, both 0.9% sodium chloride and 10 ml, and date 11/2020 and 9/2020.
Thank you very much. I will now attach my cannula to the sodium chloride and ensure there are no air bubbles. We don't want any air embolisms. And we want to make sure we do it in the top third of the patient's neck so that we don't go near the clavicle and we're not at risk of puncturing the lung. So sharps out. Right, so I'm just going to press down and distend my patient's vein. I can see that clearly. I'm going to insert that at 30-degree angle. I'm going to also provide traction, set it at a 30-degree angle. I am going to aspirate. I have flashback, so I'm now going to flatten, and while holding the needle still, I'm going to advance the plastic catheter. Right, straight into the sharps. I'm now going to attach my lower. Okay, so I'm now going to take my second flush. I'm going to flush this with 5 ml sodium chloride to ensure that my line is patent. I will now secure the line. I will also record on the line the date and time that it was administered, the route that it is administered. I will also record on the APR the attempt, the sites and the attempts, how many attempts there were. So that has been recorded and also recorded in my EPRF. And there is that EJV.